everybody, it's me, Kristen. So I just wanted to make this video to talk a little bit about like healthcare facilities for people if they need memory care and stuff like that. So what we found, which was kind of shocking, well, because we hadn't really. So let me preface this by saying, in case you hadn't seen my other videos, my mom had Parkinson's and dementia, and at one point we were considering, if she needed to be in a facility to, to better take care of her. But then, I went to one that was considered pretty good in our area, and, even the hospice people said it was a good one, and, it was fine, but, the patient or staff to patient ratio was just, really disturbing. For one thing, the costs for these places are astronomical. So the only way you can get Medicaid to pay for it is if your loved one has zero assets and less than $2,000 in the bank. So they have to be completely broke, have no house or car or anything. So otherwise you're going to be paying out of pocket, unless you have long-term care insurance, which I'm thinking might be a good idea, but I don't know. Anyway, so the cost of these things are basically the room itself, just the room, is $6,000 a month. And then you have to pay for services on top of that. So it can cost up to $12,000 or $14,000 a month. And it's just and the prices can keep going up if your loved one has a lot of needs, because they charge by basically what the person needs. So it's just completely ridiculous. And you'd think for that kind of money you'd be getting gold star treatment, one-on-one care or something. But so I went to this facility and checked it out, and they're oh yeah, we have about, I think they said 3 staff members for 20 people. And I'm just what? I think I made a face, and I was oh, that's not very good. And she was oh no, that's one of the best. We have one of the highest ratios of staff to patients in the area. And I'm just oh my God. Because at that point, my mom was needing help walking so she didn't fall over. And you're not going to get that kind of help if there's only 3 staff members and 20 patients. So, what would she do? She'd have to, sit in her room all day or something? I don't know. Because she was still mobile at that point when I was looking. And so, I was just yeah, that's not, I told my brother, and he's yeah, that's not going to work. And then they're oh, we offer this new AI thing that, they can, there's a video, and then the, AI system will tell you how the person fell, and I'm just we don't want her to fall, maybe get a person in there to help them so they don't fall, instead of spending money on AI to just tell them after the fact, well, this is how they fell. I mean, that was just so absurd to me. So, so we ended up not going down that road, and luckily we didn't really have to, but, because my brother and I were taking care of Mom, and my brother was able to lift her pretty well. Well, I mean, it was hard, but he, she could help lift sometimes, but anyway, she was still walking at that point, and we're just $12,000 a month, $14,000 a month later, and we don't have, she wouldn't even get the care she needed. So I'm just oh, no, that's wrong. And it just was yeah, they're it just seemed like a money factory for them. I mean, they must be money factories for these people who own these care facilities, because, even if there are caring people who work there or whatever, but it's just so wrong. Because I don't even know. It's I felt like it was more for people who were better able-bodied or something, you know, like, which doesn't make any sense because you're looking for a care facility and then you have to be like able-bodied to be in the care facility. I don't know, it doesn't make any sense. So then there's this other option, which was like a care home. I didn't actually explore those because after we saw this other care home, we're just like, yeah, we're just going to keep Mom here as long as we can. And I hadn't gotten around to exploring any other options before she died. So the care homes are more like, you know, someone has a house and I don't know if they're certified or something. They have nurses and, you know, probably MAs and stuff like that. And usually the ratio is like better. So there's more staff to patients. But, you know, I don't know that I don't know what kind of care she could have gotten in those places, and those are also really expensive. But I will say that one person I talked to at one of those homes was super nice and put me in contact with some other people because their facility was full. But and yeah, this other thing, like at this one facility, so they're like, well, we don't have any open beds right now, so you'd have to be on a wait list. And then in order to be on the wait list, you have to put money down. And then if you decide you don't want to go and a spot opens up, you lose your money. So it's all about money. It's gross, you know, like, you know, I don't even know. So basically they bankrupt people until they have no money, and then Medicaid can pay for it. But it's just so wrong. And I'm sure they have trouble finding people to work there because, you know, it's being a CNA or a MA or something. Who are the people who are mostly taking care of people? I mean, they have some nurses and stuff too, but they're not getting paid that well, which is like outrageous because the prices for those places are so high. So it's a really broken system is all I can say. And I'm just glad that we didn't have to put her in a facility. You know, like, she went downhill like really fast towards the end. And we were like, you know, cause she quit walking and we're like, oh no, what do we do? And then, so I called hospice, or I called her insurance company and got a emergency hospice referral. And, so we did hospice in our house. But if she had lingered like a super long time, that wouldn't have been really feasible either because, you know, that when you do hospice, they have people come in, but it's not like 24-hour care. So basically the family is the caregiver, which, you know, we were doing, but like if you're administering meds every hour, for 24 hours, when are you going to sleep? You know, things like that. So I don't know how it works in other countries like that have universal health care, but in the United States it's really messed up. So I just thought I'd make that video. Thanks for listening. Okay, talk to you later. Bye.